Let's all imagine now that you're living with some form of chronic inflammation, so inflammation that just will not stop. All right. So, for example, for one person, it might be Crohn's disease, abdominal pain, urgent trips to the bathroom, fatigue, and the constant worry that another flare is coming. For someone else, it might be rheumatoid arthritis, waking up with stiff, swollen joints, and wondering how long it will take before their hand starts working properly. And for another person, it might be severe psoriasis, inflammation reaching across the skin, visible every single day. Now, these are different diseases. They affect different parts of the body, but underneath them, there can be a shared problem. The immune system is stuck in an inflammatory state. Before infliximab, doctors often treated these conditions with broad anti-inflammatory or immunosuppressive medicines. And those medicines did work, but they were not very precise. Okay, they lowered inflammation in a general way rather than blocking one of the key signals helping to drive these diseases. That key signal was tumor necrosis factor, or TNF alpha. And TNF alpha is biologically active as a homotrimer, where, as I'm demonstrating here with this ribbon image, there are three identical molecules assembled together to become functional. So individual TNF molecules are inert, but then when they come together as a trimer, then they become functional. Okay, and this homotrimer is a powerful inflammatory cytokine produced by many immune cells. And it is an important structure because TNF receptors are also activated by clustering. Okay, so one TNF alpha trimer can bring receptor molecules together and trigger signaling inside the target cell. You can think of it as one of the immune system's alarm signals. When the body is fighting infection or responding to injury, TNF alpha helps call immune cells into action. It activates immune cells, it encourages the release of anti-inflammatory cytokines, it helps blood vessels to become more sticky and welcoming to those immune cells moving into tissues, and it helps coordinate the whole inflammatory response. In the right situation, that is useful. Okay, it helps to protect us. But if TNF signaling stays switched on for too long, that same alarm signal can then become harmful. So instead of protecting the tissue, it starts to damage the tissues. Okay, so instead of resolving inflammation, it helps to keep the inflammation going. And that is part of what happens in diseases like Crohn's disease, ulcerative colitis, rheumatoid arthritis, ankylosing spondylitis, and so on. So the idea behind infliximab was to intercept one of the major inflammatory messages itself. Okay, so infliximab, which was originally sold as Remicade, is a biologic monoclonal antibody that inhibits TNF alpha. So more specifically, it is a chimeric IgG1 monoclonal antibody. And chimeric means that it is built from both mouse and human antibody components. And the mouse-derived parts helps the antibody recognize TNF alpha, whereas the human IgG1 portion helps it function as a therapeutic antibody in the body. Note that infliximab binds TNF alpha with high affinity, but it does not inhibit TNF beta or lymphotaxin alpha, which is a more localized and weaker pro-inflammatory cytokine. In fact, at the moment, we really only use or recognize TNF alpha as the tumor necrosis factor, as it is the critical cytokine contributing to both physiological and pathological processes. And you might have already noticed that I use these names interchangeably, so TNF alpha or simply just TNF. Infliximab was first approved by the FDA in 1998, and its first approval was for Crohn's disease, and over time it became one of the landmark biologic medicines for immune-mediated inflammatory disease where TNF alpha has a significant influence. Now, to understand how infliximab works in the body, we must first understand TNF signaling, Okay, so how TNF signals to drive inflammation. Now, TNF can exist in two main forms, right? A transmembrane form and a soluble form, which really is a cleaved fragment from the transmembrane form. Whereas the soluble form is released into the extracellular fluid or local inflammatory environment, the transmembrane form stays attached to the surface of cells that produce it. So T cells, B cells, macrophages, dendritic cells, and so on. Both forms can interact with TNF receptors on many different cell types. And when those receptors are activated again and again, inflammation can build on itself. TNF signaling can increase inflammatory mediators. It can activate endothelial cells, which line blood vessels. It can help immune cells leave the bloodstream and enter tissues. And over time, it can contribute to symptoms like pain, ulceration, swelling, stiffness, skin plaques, and overall tissue damage depending on the disease. Infliximab works by binding both soluble and transmembrane TNF. Once it binds TNF alpha can no longer interact normally with its receptors, and that interrupts downstream inflammatory signaling. Now let's look at some of the approved uses for infliximab. A reminder that I'm making these videos for educational reasons only, and anything I've said or will be saying is solely for academic purposes. Okay. Crucially, the drug prescription information can vary quite widely, and these are updated regularly for any geographical location. So please always speak with your local clinician or refer to local guidelines. We have established that infliximab neutralizes TNF alpha, and by doing so, it can be useful across several different inflammatory diseases. In Crohn's disease, infliximab is approved for moderately to severely active disease in adults and in children 6 years and older when conventional therapy has not worked well enough. And by conventional therapy, I mean drugs that work generally to suppress the immune system. So things like corticosteroids, prednisone, or budesonide, immunomodulators like azathioprine or methotrexate, and then the aminosalicylates. Infliximab is also approved for fistulizing Crohn's disease in adults, as fistulas can be some of the most difficult and distressing complications of Crohn's disease. And fistulas or fistulae are simply abnormal passageways between the gut and other organs. So things like enterocutaneous fistulae, rectovaginal fistulae, and so on. And infliximab therapy helps to maintain fistula closure. In ulcerative colitis, infliximab is approved for moderately to severely active disease in adults and in children 6 years and older, again when conventional therapy has not been enough. In rheumatoid arthritis, the drug is approved for adults with moderately to severely active disease. But here, it can be used in combination with methotrexate, which is part of the approved treatment approach, as it helps to reduce immune responses against infliximab that might otherwise weaken the drug's effect or increase infusion reactions. Infliximab is also approved for active ankylosing spondylitis and for active psoriatic arthritis, and it is approved for chronic severe plaque psoriasis in adults who are candidates for systemic therapy when other systemic treatments are medically less appropriate. There are also off-label uses of infliximab. So whereas the approved uses that we talked about are backed by well-controlled clinical trials, these off-label uses are based on anecdotal evidence. Okay, and these can include conditions like Behçet's disease, pyoderma gangrenosum, and hidradenitis suppurativa. Reports have also shown usefulness in Sjogren's syndrome, refractory sarcoidosis, and graft versus host disease. So, approved uses are the formal regulatory indications. Off-label uses may still have evidence or clinical experience behind them, but they are not the same thing as an FDA approved indication. There are also FDA approved Infliximab Biosimilars, and biosimilars are really kind of very similar drugs to the original reference products with no clinical meaningful differences in their safety, their purity, or their potency. Okay, they are important because they can expand treatment options and improve access, simply because they are usually much less expensive. Infliximab is given as an intravenous infusion in the monitored healthcare setting, and that is important because infusion reactions can happen. Okay, some patients may have to receive pre-medication such as paracetamol or antihistamines or corticosteroids, depending on their history and then the local protocol. There is a hyaluronidase-based subcutaneous formulation, and this is where the enzyme hyaluronidase acts sort of like an adjuvant to help increase absorption and dispersion of the injected medicine. And this can be used as a maintenance treatment for adults with moderately to severely active Crohn's disease or ulcerative colitis after induction treatment with an intravenous infliximab product. Before we finish up with the safety concerns and drug interactions, it is important that we understand the other side of TNF alpha blockade. So far, infliximab sounds like a very elegant solution. Identify a major inflammatory signal, bind it with an antibody, and stop it from driving disease. And in many patients, that is exactly what we would want. But we must also understand that the body did not evolve it just to cause Crohn's disease, rheumatoid arthritis, psoriasis, and so on. The molecule exists because it plays a real role in protecting us. It helps the immune system respond to infections, activate immune cells, organize inflammation, and contain certain pathogens. That is why these boxed warnings for infliximab include serious infections and malignancy as well. The serious infections can include tuberculosis, bacterial sepsis, invasive fungal infections such as histoplasmosis, and infections caused by other opportunistic pathogens. So in particular, patients are screened for latent TB before starting infliximab, and they are monitored for active TB during treatment, even if the first test is negative. This is especially important because TNF helps to maintain granulomas, which are these complex immune structures that help contain some of these infections. So if TNF is blocked, latent TB can reactivate. So TB screening is a central part of safe TNF blockade treatment. The malignancy warning does not mean that every patient who receives infliximab is expected to develop cancer, but it does mean that clinicians have to think carefully about risk, especially in patients who are already receiving other immunosuppressive medicines. Now, TNF is part of inflammation, but it is also part of immune surveillance, the immune system's ability to recognize and respond to abnormal or infected cells. So when TNF is blocked, there is a theoretical and observed concern that some malignancy risks may increase in certain patient groups. The boxed warning specifically mentions lymphoma and other malignancies reported in children and adolescents treated with TNF blockers, including infliximab. And there is also a rare but serious cancer called hepatosplenic T-cell lymphoma. Now, this cancer has been reported in patients treated with TNF blockers, including infliximab. Most reported cases occurred in patients with Crohn's disease or ulcerative colitis. Many were adolescents or young adult males. Now, this is really important here. Most of them had already received other immunosuppressive medicines, especially azathioprine or 6-mercaptopurine, either at the same time or around the same treatment period. So in real clinical practice, the risk conversation is not just about infliximab alone, but then there are various factors that are also involved. And the goal here is not to scare patients away from treatment, but to use the treatment thoughtfully, really, because then you'd have to choose the right patient, screen carefully, monitor over time, and reassess the risk-benefit balance as the therapy continues. Other important risks will include things like infusion reactions and delayed hypersensitivity reactions. Infusion reactions can include fever, chills, itching, rash, chest discomfort, and so on and so forth. And delayed reactions can occur days later and may include fever, rash, joint pains, muscle pains, or a general feeling of being unwell. Now, just as TB can be reactivated by infliximab therapy, hepatitis B virus can also be reactivated with infliximab therapy. So, again, hepatitis B screening and monitoring are important where appropriate. Other risks that I have not listed here will include things like liver injury, low blood counts, and worsening or a new onset heart failure. Live vaccines are generally avoided during infliximab therapy. So vaccination planning should happen before treatment whenever possible. As infliximab can also cross the placenta, there is also a pregnancy-related vaccine issue. If an infant was exposed to infliximab during pregnancy, the drug may remain detectable in the infant's blood for months, many months after birth. Because of that, live vaccines are usually delayed for at least 6 months in infants exposed in utero. Now, note that during infliximab therapy, loss of response can happen because some patients develop antibodies against infliximab. Those anti-drug antibodies can negate infliximab efficacy, reduce effectiveness, cause drug failure, and even increase the chance of infusion reactions. That is one reason combination therapy with an immunomodulator like methotrexate, azathioprine, or 6-mercaptopurine can significantly reduce the likelihood of these anti-drug antibodies forming.